Welcome to the learning session for the Internationally Qualified Nurses Licensing Exam. Starting today, I will be sharing knowledge and updates about the Infusion licensing exam, which I believe will be helpful for those preparing and seeking support. As you may know, the Infusion is an online exam consisting of two parts, Part A and Part B. Candidates are required to answer a total of 120 questions within 180 minutes. Part A focuses on medication safety and it includes 12 questions to be completed in 30 minutes. Part B covers nursing knowledge with 108 questions to be answered in 135 minutes. Today, let's concentrate on Part A, medication safety. This section primarily tests your understanding of key safety principles in medication administration. We will explore each of the focus areas in detail. Let's start by learning metric conversions. To convert between units, it's important to understand the order of units, knowing which is bigger and which is smaller. Once you know the sequence, either ascending or descending, you can apply a simple rule. To convert from big to smaller units, you have to multiply by 1000. That means by moving 3 decimal point places to the right. From smaller to bigger units, divide by 1000. That is by moving 3 decimal point places to the left. Let's look at a few examples to understand this better. Here I mentioned the units in an ascending order, that is from bigger to smaller. As I told you earlier, once you know the sequence, either by descending order or ascending order, you just simply apply the rule. In order to convert bigger to smaller units, multiply by 1000. And in order to convert from smaller to bigger units, you have to divide by 1000. Let's go through few examples. From kg to microgram, that is big to small, multiply 1000. Microgram to milligram, small to big, divide by 1000. Liter to milliliter, that is from big to small, again just apply multiply into 1000. Milliliter to liters, that is from small to big, divide by 1000. Gram to kilogram, small to big, divide by 1000. Milliliter to liters, that also small to big, divide by 1000. And final one, gram to microgram, from big to small, multiply by 1000. So always keep in mind, in order to convert between units, it's really important to understand the order of units. That means knowing which is bigger and which is smaller. Once you understand this rule also, you can easily crack this metric conversion questions. The next is drug dose calculation. Drug dose calculations are required when the amount of medication ordered or desired is different from what is available on the hand for the nurse to administer. Always follow the formula and apply correctly to the given situation. In this case, to calculate the dose, remember the formula, that is amount desired divided by amount on hand. Let's see an example. A patient is prescribed 1 mg of a medication. The medication comes in tablet of 0.25 mg each. How many tablets should the patient take? As I told you earlier, always follow the formula and apply it correctly to the given situation. In this case, amount desired is 1 mg, amount on hand, that is 0.25 mg. So you will get 4. So you have to give 4 tablets to that patient. Clear? A drug of 50 mg per oral is ordered. That is available as 100 mg per tablet. How many tablets would the nurse administer? Plug in what you know in the formula and simply applying that. Here amount desired is 50 mg. What is on the hand, that is 100 mg, divided by, so you will get half tablets. So you will give half, that is 0.5 mg tablets. Always keep in mind that follow the formula and apply it correctly to the appropriate situation. In order to calculate the volumes for injection, use this formula. Here they are asking how to administer the correct amount of an injection. To find the volume, use this formula, that is prescribed dose into stock volume divided by stock strength available. Okay, as I told you, always stick on the formula and just apply that. Here you can see the prescribed dose as 50 mg. So 50 mg pethidine is prescribed by the doctor. The stock strength you have is 100 mg in 1 ml. So stock volume is 1 ml, stock strength available is 100 mg. Just apply this formula, then it will be 50 mg, that is prescribed dose, into stock volume, that is 1 divided by 100, to give 0.5 ml to the patient. Clear? Let's see one more example. Patient needs 250 microgram of ordered drug. You have 1 milligram in 1 ml. How many ml do you give the patient? Here, please remember, if the unit of the prescribed medication that is different from the available stock unit, you must first convert the prescribed unit to match the stock unit. For example, if the prescribed dose is 250 microgram and the stock strength is 1 milligram, you have to convert microgram to milligram. Just apply the metric conversion rule by dividing by 1000, which gives 0.25 milligram. Then only you have to apply the formula accordingly. Follow the formula. Prescription for the patient into stock volume, that is prescribed dose into stock volume divided by stock strength available, that is 0.25 milligram into 1 divided by 1, that gives 0.25 ml. So in this type of questions, always keep in mind that if the unit of the prescribed medication is different from the available stock in the unit, first you have to convert that to the matched stock available in your unit. Okay? Let's look another type of questions. Calculating the total divided dose and determining the single dose. It's important to be familiar with medical abbreviations such as BD, that means twice a day, TDS, that indicates 3 times a day, and QDS 4 times a day, and some medications are administered every 4th hourly, that is 6 times a day. That you should know in this set of questions. Simply apply the formula, that is prescribed dose into patient's body weight to get the total dose. Here patient is prescribed ibuprofen 5 mg per kg per day in 3 divided doses. She weighs 60 kg. Calculate her daily dose. What is the single dose? As I told you earlier, to find the single dose, divide the total dose by number of divided doses. And always remember the common abbreviations like BD, TDS, QDS and so on. If the answer needs to be in different unit, apply the conversion rules. Okay, that is from big to small multiply by 1000, from small to big divide by 1000. Here the given dose is 5 mg per kg per day. The patient weight is 60 kg. Simply apply the formula 5 into 60 kg, that is 300 milligram per day, that is the total divided dose. In order to find a single dose, divide the total dose by number of divided doses. Here the number of divided doses is 3, so 300 divided by 3, that is 100 milligram is a single dose. Clear? Let's see one more example. Here the patient is prescribed so and so 25 milligram per kg TDS. So TDS, that indicates 3 times a day. She weighs 70 kg. Calculate her total daily dose in gram. As I told you earlier, just apply the formula, that is prescribed dose into patient's body weight to get the total dose. But the thing is, here they asked they need to be in different unit, that is calculate her total daily dose in grams. So once you got the formula, once you got the answer, that is the total dose is 25 milligram per kg 3 times a day, that is 25 into 3, that is 75 mg, and multiply that into weight of the patient, 70 kg, that is 5250 milligram per day. So you have to convert that into gram. In order to convert small to big or big to small, just apply the formula. Okay, here from small to big, that is divided by 1000, 5.25 gram you have to give to that patient. Clear so far? Let's look another type of questions where you are asked to calculate the intravenous drip rate or infusion rate. The formula is to calculate the flow rate, volume in ml divided by time in minutes into drop factor. If the time is given in hours, you have to convert it into minutes by dividing by 60. And if the time is given in minutes and you need it in hours, divide by 60 in order to calculate the infusion drip rate. As I mentioned earlier, always stick to the formula and check if any unit conversions are needed before applying it. Okay, let's see an example. Here you have to calculate the IV flow rate for 250 ml of 0.5 dextrose to be administered over 180 minutes. The infusion set has a drop factor of 30 drops per minute. Here the formula is, in order to calculate the flow rate, volume in ml divided by time in minutes into drop factor. Here the total volume is 250 ml and the mentioned time is over 180 minutes that you have to give to that patient, and the drop factor is 30 drops per minute. Simply apply that into the formula, that is 250 divided by 180 into 30, that is 41.667. You can round it as 42 drops per minute. Clear? So always stick on the formula. If needed only you can apply this conversion. Okay, here no need to convert anything because it's given in minutes. The time is mentioned here in minutes. Let's see another one. Here 250 ml of blood is to be given over 4 hours using a blood administration set, that is 15 drops per minute. If it's mentioned that a standard drip set or macro set is used, the drop factor is 20 drops per ml. Okay. If a pediatric set, micro set, or if blood or any blood products are being administered, then the drop factor is 15 drops per ml. Okay. Always pay attention to these details as they determine which drop factor to use in this formula. Moving further with another question. Here 250 ml of blood is to be given over 4 hours by using a blood administration set, that is 15 drops per ml. Calculate the drip rate per minute. Here the volume is 250 ml, the time over is 4 hours and drop factor is 15 drops per minute. The formula says, in order to calculate the flow rate, find the volume in ml divided by time in minutes into drop factor. So you have to convert in hours, convert the time in hours to minutes by using this conversion rule, multiplied by 60. So 4 into 60, that is 240 minutes. So you converted from hours to minutes by using this formula. Then you can apply the formula Like total volume is 250 ml divided by time is 240 minutes into drop factor, that is 15. Then you will get 15.625, and the drop rate is here. The calculate the drip rate per minute is 16 drops per minute. Clear? Let's see how to calculate the infusion rate in ml per hour. Here we use the formula flow rate is equal to volume to be infused, that means total volume to be infused, divided by time in hours. If the time is given in minutes, first convert it into hours by using this formula by dividing by 60. I repeat, to calculate the infusion rate in ml per hour, we use the formula, that is volume, total volume to be infused divided by time in hours. So if it's mentioned, if the time is given in minutes, first you have to convert it to the hours by dividing 60. Let's look at an example to understand this better. Okay. You are required to give 250 ml of intravenous fluid over 30 minutes. Calculate the correct rate in ml per hour. Here the total volume is 250 ml. Time to be infused over is 30 minutes. So as I told you earlier, you have to calculate this correct rate in ml per hour. So you have to convert this 30 minutes into hours by dividing by 60. 30 divided by 60 is equal to 0.5 hour. So just apply this formula, 250, that is total volume, divided by time in hour, that is 0.5. Then we will get the rate. Flow rate is 500 ml per hour you have to infuse to that patient. Clear? Let's see the next dose calculation, that is how to calculate a safe drug dosage. Here, to calculate a safe drug dosage, use this formula. Recommended dose per kg, that is, the doctor is prescribed a particular medication to a patient who weighs so and so. They will give you a safe dosage of that particular drug per kg. So, you just plug on that recommended dose per kg into patient weight in kg. That will give you the maximum safe dosage to that patient can apply. This gives you the maximum amount of drug that can be safely administered to the patient. Okay, let's go through an example. Here, a particular medication 4 mg has been prescribed for a child who weighs 20 kg. The safe dosage of this drug is 0.2 mg per kg. Okay. For this patient, your recommended dosage per kg is 0.2 mg. Is 4 mg a safe dose? That is the question. Just plug into the formula. 0.2 into weight of that patient is 20. That gives 4. Yes, 4 mg is a safe dose. Clear? Let's see another example. Here, a particular drug 3 mg has been prescribed for a child who weighs 17 kg. The safe dosage of this drug is 0.1 mg per kg. Is 3 mg a safe dose? Here, the recommended dosage of that particular drug is 0.1 mg per kg. And weight of the patient is 17 kg. So, how to calculate the safe dosage? Just plug into that formula. Safe dosage is equal to recommended dose 0.1 mg into the weight of the patient is 17, that gives 1.7 mg. So our question is whether 3 mg is a safe dose. What's the answer? No, 3 mg is not a safe dose, that exceeds 1.7 mg. Okay, is that clear for you? From a medication safety perspective, apart from this dosage calculation, you may also be asked 2-3 questions related to the action or effects of specific drugs. For example, if a patient is prescribed aminophylline, you might be asked to describe its mechanism of action. Or in case of morphine, you may need to identify its major side effect. I will include such questions in the upcoming learning sessions. Until then, continue practicing the current topics by applying the given formulas.